Hello, my name is Dr. David Furlong. I'm welcoming you to this Spirit Release Forum conference, which is given in February 2017. The video presentations, which are of the various talks given at the conference, and these were exploring different issues of spirit attachment, spirit release. The theme of the conference was spirit influence on mental health. Is spirit intrusion an important overlooked factor in hallucinatory disorders? I do hope you enjoy the conference and all that it is covered here, as there were some fascinating talks given. It gives me great pleasure to introduce again another friend and colleague. I think we could call ourselves that.
I've been for a long time now.
Yes, probably over many lifetimes. But I'm delighted to be able to welcome Dr. Terence Palmer. He did his thesis actually on spirit release, but I know he's going to share with you something about some research projects which are going on in trying to look at and understand the way in which spirit can influence people, and also the steps which can be done to help heal those processes. So welcome, Terry. Thank you.
Thank you, David. I was just saying to Fiona just a moment ago, it's very, very refreshing to be able to talk to an audience of people, a room full of people who are like-minded and don't have to be convinced that we have a spirit world. Because most of the conferences that I present to are skeptics, and it's like stepping into the lion's den, and it's a bit tricky. Now, I'm going to give you a presentation in a moment, but first of all, just a formal introduction. Whilst scientific investigations into the nature of consciousness, into psychic phenomena, now called psi, and anomalous experiences have become academically fashionable in recent years, but medical science stubbornly refuses to acknowledge the reality of a spiritual realm and the spiritual causes of mental and emotional distress. And that's partly probably due to, I think, the investigations into consciousness and psychic phenomena and anomalous experiences, because they still refuse to acknowledge spirit. The word spirit in scientific research of all persuasions is a taboo. And the taboo has to be broken. We recognise that we live in two worlds, the physical and the spiritual. And until medical science acknowledges that, we have an enormous uphill battle. News reports from Italy are announcing that there's been an exponential rise in requests for exorcisms by the Catholic Church. In the UK, the mental health services of the NHS are not able to cope with the demand for psychiatric services when patients report hearing voices and commit suicide. And the situation is dire. And the BBC recently reported on the news that the system is broken. Actually, it's been broken for an awful long time. On a broader scale, mass killings by people hearing voices are on the increase. Both the mental health services and criminal justice systems in the USA, I've recently come back from the USA and looked at this, and Europe appear to be totally blind to these realities, or Are they determined to maintain the status quo for institutional self-interest? Is it because there's more money to be made by keeping people on antipsychotic drugs than curing them, and more profit for private mental health hospitals by the NHS outsourcing the problem? And of course, outsourcing means privatisation, which means profit for someone. And these are not just ideas that have popped into my head, because I'm a researcher. And I'm not going to bore you with giving statistics that I've come up with, but I've also been privileged to be able to witness this myself, where I've seen people being sectioned under the Mental Health Act and being put into a hospital where there are no beds. So then they are outsourced to the private clinics, where the private clinics are charging something like £800 a day, whatever they charge. And this is all draining NHS budgets. Let me just get the top off this. So the position that I'm coming from, I am actually a spiritual healer. Started off as a spiritual healer, but I needed to understand spiritual healing, so I went to university. And when I did my degree in psychology at Christchurch, I learned absolutely nothing about the spiritual dimension at all. But what I did learn was how to conduct scientific research. So I thank psychology for that. So I can, again, using a euphemism, I can walk two worlds. I can walk the scientific world and I can walk the spiritual world, because I have knowledge of both. And what I'm trying to do is to encourage practitioners in spirit release methods to adopt methods that can be incorporated into a program of scientific research. First, let's have a look at some fundamental facts. And these figures are not up to date. I put these together for a conference last year, so they can probably be upgraded. Approximately 220,000 people in England and Wales have a diagnosis of schizophrenia. In 2007, it accounted for approximately 30% of the total expenditure on adult mental health and social care services. In the UK, 5.7 million prescriptions for antipsychotic medications were written in 2005 at a cost of £210.9 million. Further, 163,600 long-acting antipsychotic injections were prescribed, costing £5.2 million. Globally, we have to thank Emma Bragdon for this. Globally, the value of psychotropic drugs alone topped 40 billion in 2008. It's a lot of money, isn't it? I bring this up purely to illustrate what I believe is to be a dichotomy of beliefs. On the one hand, you've got the religious and the spiritual, and we have a few subheadings there that can come under the religious, spiritual belief systems. And on the right, you have the mechanistic. And I've put these up in order to show the parallel between the two. And I'm not going to waste time and go into a great detail on this, but it's something for philosophers of science to study. But on the right-hand side, we see the mechanistic. It is still a system of belief, and we can choose which path to tread, the religious or spiritual belief path, or we can choose to tread the mechanistic belief path. But when you take evidence from psychiatrists with an open mind, and they practice with an open mind, what we find is evidence. Psychiatrists like Shakuntala Modi in the United States recorded 92% of problems were attributed to spirit influence. 92 of 100 of Modi's patients were found to have earthbound spirits attached to them. 80 patients had more than one. 50 patients had spirits of relatives, and 77 patients had spirits that were described by Modi as demonic. Of course, Modi, being a medically trained psychiatrist, she's been trained in keeping accurate records. So she's keeping notes and she's recording everything. And then she has the ability to study the patterns in the reports that she comes up with long after they've been dealt with. So she can produce statistical tables of what she's been treating. Modi's analysis also revealed that 80% of primary symptoms, such as depression, anxiety, panic attacks and psychotic symptoms, and 30% of secondary symptoms were caused by spirits, whilst 20% of primary symptoms, 70% of secondary symptoms were caused by past life traumas. Now, Edith Fiore, some of you may be familiar with, according to her, 75% of her total caseload is attributable to spirits. So these are medically trained practitioners who are using their knowledge of data collection and analysis to present their findings. So what's really needed is not a dichotomy of beliefs with spiritual and religious on one side and scientific on the other. It needs to be an integrated approach. Now, I know I'm speaking to an audience here that would agree with me that this is just common sense, just plain common sense. So it's a bit of a mystery to me as to why medical science doesn't acknowledge this common sense. There's something really odd going on here, because these are intelligent people. So after working for several years now, and since I was introduced to this principle by Dr. Alan Sanderson, who's sitting right in front of me, thank you, Alan, for helping me step on this pathway 16 years ago, thank you. We've been trying to educate the psychiatric community, haven't we? And we're getting nowhere. I don't think we're getting anywhere. So we have to take the initiative ourselves. And a group of families have come together with help of David's coordination. And this is a service user initiative. And I want to talk about two initiatives that have been introduced today, and this is the first one. It's called the Ross Project because it was started at Ross on Wye on the 1st of November. And all members of that initiative, I'm happy to say, are all here today. So here follows a small-scale research project that's been initiated by 3 independent families who have a family member with a diagnosis of psychosis. Now, if I say anything wrong, anything you don't agree with, you're all here. You can pull me up and say, hang on a minute, that's wrong. So correct me if I'm wrong. The 3 families are of the opinion that a complementary spiritual intervention can contribute to the recovery and well-being of their loved one. Their belief in a complementary intervention is expectant of the psychiatric community responding with its active participation in the project. And I'll go on to explain why I think that is. Aims and objectives are very, very simple: to ameliorate the distress of 3 patients diagnosed with psychosis, to test the efficacy of spirit release therapy methods in the amelioration of distress of patients diagnosed with mental illness, to arrive at a complementary and integrated approach for clinical best practice in the treatment of mental illness. That means working with the psychiatric community. Here, the experimental hypothesis, very, very simple one. SRT intervention will complement traditional psychiatry in the treatment of psychosis in the short term. And complementary SRT will reduce the costs of traditional mental health care in the long term. And how often do we hear news reports on the television about how much money the government is going to pour into mental health services. Well, I'm sorry, but I don't believe that they could pour any amount of money into what they continue to do and get a different result. The experimental design, now, according to my understanding of psychological and psychiatric methods in clinical trials, they're usually conducted with ticking box form psychometric instruments, which, to my way of thinking, in my experience, have absolutely no value whatsoever. What I'm suggesting here is what we've got is a longitudinal study with 3 separate cases of psychosis, where we are using SRT methods, as in one-to-one therapy, which is what David was talking about earlier, the way he works. Remote with 1 therapist and 1 medium, which is the way I often work. Remote with 2 or more mediums. And conversations with spirit guides through transpossession, which is fascinating. I know David does that, and I work with a medium that does that. If you have a question you need an answer to, the medium goes into a trance, the spirit takes him over, it's positive possession, and you're having a conversation with the spirit, and you're getting the answers you're looking for. So these 4 methods can be applied in investigating the cause of the illness and asking for a program for a remedy. And the method, as I say, is qualitative rather than quantitative. So we're not asking people to tick boxes and answer questionnaires. Each of the 3 cases is to be addressed by 3 independent interventionists. There's a therapist or a pair of practitioners or a group, independently, and no psychometric instruments are used for data collection. The data is collected through interviews. So, putting it very, very simply, you have a person who's hearing voices, a person who's been diagnosed with psychosis by a psychiatrist, and you interview that person or the family member and you say, what's the problem? And it's explained in simple language what the problem is. And that's your baseline data, recorded. The results of each case consist of 1 initial baseline interview and then 3 intervention reports. So just be clear about this. You've got 1 patient, and each patient is investigated by 3 different practitioners. Because everyone works differently. We've heard today how David works, and we've also heard today how Mike works. And there are certain differences and inconsistencies in their approach. As a scientific project, we need to understand what each approach can contribute to that person's well-being. So we use 3 different methods. Mike uses his, David uses his, I use mine, and then they are analysed afterwards to see how well our assessment fits or meets and correlates with the initial baseline data. So all interviews and interventions are recorded, which means that they can be transcribed for analysis. It's much more accurate than listening to a person and taking notes. Because I, for one, I am not multitasking. I can't listen to a lecture and take notes at the same time, because as I'm writing, I'm missing what's being said. I think women can multitask, can't they? But I can't do that. So I find it easier to record everything, go back later, listen to it, and transcribe later. And that way you don't miss anything. And then each case report is to be given to ideally be given to an independent researcher or qualitative analyst. I say ideally because we don't have one yet. What we're looking for from a researcher is to identify inconsistencies and correlations between the different SRT interventions. I'm sorry, but I'm talking statistical language now. I'm talking scientific research language, which most therapists don't really resonate with. But this is where we have to bring the two together. To analyse differences, if any, between baseline data and the final outcome report from the patient's family. Putting that simply, is to ask the question, does it work? Is there a difference? Baseline data before, post-intervention interview, are you still hearing voices? What are you experiencing now? Of course, with a simple case, as David was saying earlier, a simple case can be dealt with in one day, in one session, in 20 minutes. But these more complex cases do take longer, and they're complex, and there's a lot to be unravelled from the different levels of consciousness, the past lives, the subpersonalities, the DFEs, the earthbounds. They all have to be investigated. But what I find fascinating about this is what each interventionist discovers when they go in, and what they can contribute to the whole picture. So that's the Ross project. Here's the second initiative that I want to talk about. And this is just being conducted by myself and the medium that I work with. Unfortunately, he can't be here today because he's a working man, got a full-time job. Andrew Porter is a medium who channels his guide Chen. And we were given this project to do by Chen, actually, by the guide, who said, we want you to do this. We want you to set up a website called Hearing Voices Help. And we want you to help people who hear voices. So we said, okay, let's do that. But we need to attract people to us that hear voices so that we can work on and show that it works. So then straight away we were contacted by a gentleman in North Yorkshire who's an ex-soldier. And last weekend, on the 28th of January, at the Equilibrium Health Centre in Wiltshire, he came down on the train from North Yorkshire and presented himself. This is an ex-soldier who'd served in the Balkans and in the Middle East, in Afghanistan. Richard was there. He sat there nodding. And he reported that he'd been pestered by a gang of voices for the past 23 years. He'd been through the psychiatric system, diagnosed with schizophrenia, been to all the ex-services charities that are there to treat soldiers who are suffering from post-traumatic stress disorder, and he'd been diagnosed with post-traumatic stress disorder. And he sat and told us what the problem was. And we conducted a spirit removal exercise with him on camera, and thankfully Ben, the camera crew, were there to record this. And that was last Saturday. And he was immediately freed of his voices. Immediately. Came back to me the next day and said, I'm having trouble getting used to this because I've been living with this for 23 years. And his biggest concern was the anger that he was experiencing at being made to suffer this when it could have been dealt with. And this is his These are his words. I'll let you read them. So what we plan to do is carry this programme forward, and with Sue Allen's help, with her School of Intuition Healing, the next workshop is to be held next Saturday. No, it's the 18th. It's not next week, is it? It's the week after. The 18th. And for this workshop, we're actually still looking for a volunteer. We're looking for someone to come forward who's hearing voices. And we can work in one of three ways. We can do the one-to-one therapy that I did with the guy from North Yorkshire. Another way we can work, again, is one-to-one, but with the support of the medium and the guide in presence to show how that works. And the other way we can work is completely remotely, but we still need a person to ask for the work to be done on behalf of a friend or family member who is not present. So if any of you want to come along to that workshop, by all means, please register and come along and see how it's done. But we are looking for at least one volunteer who needs to be rid of their voices for that workshop. If we don't get a volunteer, we'll have to cancel, otherwise, we can't show how it's done, can we? And we're also talking about a programme with the Harry Edwards Healing Sanctuary, because they've informed us that they're constantly being approached by people who hear voices, but they don't know how to deal with them. So we're going along to show them how it's done, but we haven't got dates yet. Now, the big event that is coming up, where we will be demonstrating this approach at a live workshop. Put this date in your diary, the 30th of August 2017, at Liverpool University, the International Society for Psychological and Social Approaches to Psychosis. And we have been invited to give our workshop there. And I think that's an important date. Hopefully by then we'll have a few more cases between now and then to add to our database of examples and successes. Now, the biggest problem that we have to face is finance. I mean, the equipment we use just to communicate and to travel from A to B, it all costs money, right? And none of us have got research grants. Research foundations that provide grants for complementary approaches to healthcare. Does anybody know of any? Yeah, because I don't know of any. So if anyone can point us in the right direction where we can apply for funding to carry out this research, suggestions will be gratefully received. In the meantime, we need all the help we can get. The Hearing Voices workshops, there is a cost attached to them, so hopefully the fees paid for people attending the courses will cover the costs. But we've also set up a facility to enable people to contribute online. So that, my friends, is what I have to say about research. And I sincerely hope that sooner or later an institution is going to step forward, whether it be a medical school or a university or any kind of research institution, where they teach students how to conduct qualitative psychological research studies. Because this is a perfect example, a perfect project for an MA or a PhD student who wants to practice qualitative research to really get their academic teeth into. So I just would like to hear from any institution that would find this project interesting. And that, my friends, is all I have to say. Thank you.